650. So, telemedicine. If you haven't tried it, I have not myself, but it's growing very quickly. This idea of dealing with your doctor on your computer, on your iPad. Dr. James Pinckney, Dr. James now joins us. It's diamondphysicians.com. How's it going, Dr. James?
Hey, good afternoon.
Yeah, great to have you here. Do you do telemedicine yourself?
Absolutely. You know, we have a new style of medicine called affordable concierge or direct medicine down here in Dallas, Texas. And telemedicine is a huge piece of our model because it's so efficient and effective.
So how does it work? You get on your your iPad or your iPhone or your phone, and how does the session typically run?
Yeah, absolutely. Well, we have, first and foremost, the iPad and Skype and things like that, FaceTime, they're not HIPAA compliant. So if our clients want to communicate via those means, they just sign a waiver saying it's okay. And most of our
basically, the
do
privacy is not guaranteed, you're saying?
Exactly.
Okay.
If someone wanted to hack into that feed, they could, but I mean, what are the odds of that really happening?
So how does it proceed? Do they show you the part of their body that hurts, or how does the thing go?
Yeah, well, usually just like a normal visit, we talk about the issues that are happening, the chief complaint, we get a past medical history, history of present illness, and then I start asking questions about, okay, let's take sore throat, for instance. Let me see the back of your throat. You have a flashlight, shine in the back of your throat. Let's take a look here. If you have a rash, let me see the rash.
Yeah, but you
things
can't.
that are visual.
Right, you can't check their blood pressure, though, right, or their temperature. There are things you can't do, right?
Of course. So anything that has to be done in person can't be done via telemedicine. So things like abdominal pain, those are things that I really want the patient to come in to the office and let me assess in person. But 90% of medicine is algorithms. So a lot of things can be handled over the phone very efficiently and very effectively.
And so they show you the symptoms, if it's maybe the sore throat or whatever it might be, and then you can just prescribe the medicine right there?
Absolutely. So we still use evidence-based medicine. We still use our evidence-based algorithms. And if I determine that antibiotics are needed or a steroid dose pack is needed, then I call that prescription into the pharmacy. And actually, we have e-prescribing technology now, so everything is automated. And I'm on my laptop, and during the course of the interview, if I'm doing a Skype interview, I can still have my electronic medical records open, write the prescription while we're still chatting, and send it to the pharmacy.
Is this just a portion then, or a majority of the patients you deal with, you do it this way?
It's client choice. So whatever is most efficient for my client. I'm a concierge doctor. We charge a monthly fee, a very low monthly fee. Kids are $45 a month. Adults are $95 to $295, and that pays for unlimited visits, no copay, 24-hour access to the doctor, and all your acute medications and acute procedures are included. So if the client wants to call me on the phone at 10 o'clock and we can get to a result and figure out what's going on via the telephone, then that's great, or via Skype or FaceTime.
So you really have clients all over the country then, right?
Well, we establish care in Texas, but we do have some clients that are out of state, but the first visit has to be done in Texas. That's
in
where our medical
person.
license
So
is.
You have to have an initial meeting in person. Is that something we're going to bypass at some point and just allow pure telemedicine?
Yeah, the laws right now have bypassed that establishing care in person, but since our practice is a concierge practice, we do require that. But I could, for instance, if I was a telehealth company, prescribe over the phone without seeing the patient. So the laws have been changed and updated to allow telemedicine to be an effective means of healthcare services.
Yeah, I mean, we're not far then from maybe having them be able to wear devices that tell you, right, their blood pressure and analyze other things. Are we going to get to a point soon where none of us will really have to go to visit the doctor personally?
Well, I hope we don't get to that point because it is very important to see your physician in person, face-to-face, a few times a year. But I think telemedicine should be used as an adjunct to the in-person patient-physician face-to-face visit.
Gotcha. So you can actually look down someone's throat, and you can actually see, even on their webcam or on their phone, clearly down there, huh?
Sometimes we have to get a still picture, but we have different tricks that we can utilize to gather the information we need to make an informed decision and do what's best for the patient. That is always the key. So if I can't determine something over the phone, they have to come in, and I think that is the component that telemedicine is missing. There's no option to come in to see the doctor with true telemedicine.
Yeah.
So with our version, we utilize telemedicine to deliver our services, but not all the time. The patient has the option to come to the office.
And it's Dr. James, the website diamondphysicians.com. I guess they can show you a rash and just say, hey, does this look serious to you, right? That kind of thing?
Absolutely. I get pictures of rashes all the time.
Dr. James, thanks.
Thanks for having me on the show.